This is an overview on temple mapping and injections. First, locate the superior border of the temporal region, which is the temporal fusion line. This is also the location of the superior temporal septum ligament. This landmark is easier to palpate closer to the brow, but if you're still having difficulty, ask your patient to clench down and feel where the contraction of the temporalis muscle stops. Next, you'll want to locate your inferior border, which is the lateral zygoma, and mark that out as well. Your medial border is the orbital rim, which is easier to palpate and locate, and this is also the location of the lateral orbital thickening ligament. Next, palpate and be cautious of the superficial temporal artery, which arises from the external carotid system. The superficial temporal artery has a frontal and a posterior branch, and it's important to note that there is an anastomosis between the frontal branch and the supraorbital artery. Other significant vessels you'll want to be aware of are your anterior and posterior deep temporal arteries. These are located 1.5 to 2 centimeters and 2.5 to 3 centimeters lateral from the orbital rim, respectively. Next, I'm marking out the zygomatico-orbital artery, which bifurcates from the superficial temporal artery. Lastly, I'm including the temporal branch of the facial nerve, which is located in layer 4. And now let's get to our injection techniques. When treating the temple, you can either use a needle or a cannula. If you're going to use a needle, you can use Arthur Swift's 1-up, 1-over technique or the gunshot method to place product deep on periosteum. You find this injection site by traveling 1 centimeter up and 1 centimeter lateral to the temporal fusion line's origin from the lateral orbital rim. If you are using a cannula, I like to use a 25 gauge 1.5 inch cannula, and here are the 2 port sites that I use. One of which is below the inferior border of the temporal fossa, and from here you can access layer 2 or layer 4, which are your intended injection layers when using a cannula. You can also place your port site above the temporal fusion line. Accessing this entry point can be helpful to get your cannula into layer 4, as the periosteum of the forehead is synonymous with the loose areolar tissue or the gliding layer within the temple.